If you're suffering from dizziness or vertigo, then keep watching. This video is for you. I spoke about this problem yesterday. A lot of people get dizziness and vertigo and never seek treatment for it, or take many, many years or months or weeks to seek treatment for it, because simply people don't know that there are solutions out there for dizziness symptoms. And there are specific diagnoses for people with dizziness and vertigo, and there are quite a lot of them. Now, one of the biggest problems with dizziness and vertigo is not a lot of people have an accurate diagnosis, because not a lot of people are actually trained in how to diagnose what's going on with a dizziness or vertigo patient. But the good thing is that here at Adjust, we actually run a vestibular clinic, or a vertigo clinic. Okay, so I'm going to show you the little piece of technology that our vestibular physios use in order to diagnose what's going on with your dizziness and vertigo. So you can see here, I'll bring it a bit closer to the camera. This is a Vesticam. These are Vesticam goggles. Okay, so they're a little bit like swimmer goggles that you pop on your head, and they've got these special, very, very accurate cameras in the front that are linked to a special phone with an app on it. Which our vestibular physios use when they assess your dizziness. So what happens when you come into our vestibular clinic is the practitioner will ask you a number of questions to work out what they think might be going on for you, and they will generally pop a set of these goggles on and do a couple of tests. And what happens is, as we're doing the tests, the cameras actually record what happens with your eye movements, and what happens with your eye movements is really important in terms of diagnosing exactly what type of vestibular problem you have. And not only that, by having a proper diagnosis, it allows the practitioner to be able to do very specific treatment for you, rather than just trying a random maneuver and hoping that it works. A lot more accurate than just, sort of watching somebody's eyes. So if you're having dizziness and vertigo problems, please send us a message or get in touch with somewhere that has these goggles. If they do not have a set of these goggles, chances are that they're not trained specifically in dealing with dizziness and vertigo properly. And so I would caution you on using anywhere that doesn't use this type of technology in their clinic. But certainly if you're local to us, send us a message and we'll ask you a couple of questions to work out what's going on with you and whether this is appropriate for you, or whether we should be sending you to a doctor. And then from there, you can come in and have your test and have your dizziness finally diagnosed and probably treated with good success. The good thing is that vestibular problems generally are treated conservatively really easily. Okay, so any questions, send them through. Otherwise, I'll see you in the next video. Okay, thanks. Bye.